The latest headlines in your inbox twice a day Monday to Friday plus breaking news updates. Medical chiefs today added a new loss of smell or taste as a third official symptom for detecting coronavirus. They believe it will mean that 2% more cases of the killer infection will be picked up. But the government is facing claims that it has acted too slowly on expanding the list of symptoms and is in fact missing up to 70,000 people who currently have COVID-19. Deputy Chief Medical Officer Jonathan Van-Tam announced this morning that the government's basic case definition for COVID-19 will now be a new continuous cough, or fever, or anosmia, a loss or changed sense of normal smell or taste. People with these symptoms will be told to self-isolate for 7 days, or 14 for a household if one person has them. The new and emerging Respiratory Virus Threats Advisory Group, Nervtag, which advises the government, has been investigating anosmia as a symptom of coronavirus since March 27. However, Professor Van-Tam stressed it was a difficult piece of science to establish whether loss of smell was not only a symptom but that it occurred early enough to be a useful help in detecting more cases. Getting a handle on whether anosmia is a super early symptom versus one that occurs later on when actually in terms of spotting cases it makes very little difference was something we had to work out very carefully, he said. UK stays alerts during coronavirus. In pictures, it's not just about whether anosmia exists, it's about what role it plays in identifying cases. We have taken time to be sure that the signal was absolutely correct. Anosmia will be described for clinical purposes as loss of, or a change in, normal sense of smell. But the public will be told that it could also be linked to a loss of taste, given that the two are often closely associated. Professor Tim Spector, Professor of Genetic Epidemiology at King's College London, which has a widely used COVID symptom study app, believes the government is grossly underestimating how many people have COVID-19. We are probably missing at the moment between 50,000 and 70,000 people out there who are infected, he told BBC Radio 4's Today programme before the announcement on the third symptom. He stressed that the KCL app listed 14 symptoms which he said were known to be related to having a positive swab test for coronavirus. These are not being picked up by the NHS, and 17 other countries, the World Health Organization, the EU, even the CDC in America weeks ago have actually altered their list of symptoms that they know are related to being infectious, he added. So, at the moment people are being told to go back to work, if they are a care worker, and they have got something like loss of smell or taste, or severe muscle pains, or fatigue, things that we know, we have shown are related to being swab positive.